my name is Mohammad Ghaznavi, and today we are going to have a speaking session with Dr. Asma. She is originally from Sudan. Thank you very much, ma'am, to giving us the time and opportunity for you and for the students who will be listening to us for the OET-Medicine speaking session. This will be Otitis media card that we'll be doing over here. So let's roll it. Hello, my name is Mohammad. I'll be your interlocutor today. So basically, this will be a speaking session, and we'll be having a card. It's from the OET-Medicine, and the scenario is Otitis media, right? So I believe that you have received the card.
Yes, I
So normally in the exam, you'll be having 2 to 3 minutes time for preparation, and during this time, you can take the notes. You can ask any question related to the, like the exam of speaking. So if you are ready, we can start the card. We will be having 5 to 6 minute time for counseling. During the time, you can have the card, you can see the card again. So please feel free to ask me any question if you're having.
I don't have any questions.
Okay, let's start the scenario then. We have 5 to 6 minute time for that.
Good afternoon.
Good afternoon.
My name is Dr. Asma Qureshi, and I will be looking after you today. So may I have your name, please?
My name is Michael.
So Michael, how old are you?
I'm 32.
Okay. So what have brought you to me here today?
But doctor, actually I'm having difficulty listening from my left ear, I had pain for the last 3 days, no matter if I had taken, like the painkiller, but the pain was not settling. So when I woke up in the morning, I have noticed a pulse on my pillow, which I believe to be, like from the same ear, the left one. And now I'm having difficulty listening. That's why I'm quite worried about my listening.
Right, Michael. First of all, I'm really sorry to hear that you're going through this for 3 days.
Mm-hmm.
Well, would you mind if I ask you further questions about
Sure.
this?
Sure.
So you're telling me at first you're having painful left ear
Yeah.
for 3 days. And this morning you've noticed there's some liquid, let's say,
Yeah.
over your pillow.
Yeah.
Okay. So were you hit by something, or how did it start, the whole situation?
Well, doctor, it was like the pain, initially, and it lasted for 3 days. It was quite severe that even I cannot sleep at night.
Right.
So, but in the morning when I woke up, surprisingly, there is no pain, but I'm having difficulty listening.
Right, and the pain only settled after you took the painkiller. Is that correct?
Yeah, even painkillers were not effective.
Okay, so Michael, would you mind if I examine you?
Sure.
Okay, having examined your left ear, I have seen that there is some, you have an infection, let's say. But before jumping into that, do you have any idea what you might be having?
I don't know. I have no idea about that actually.
Right. So after the examination, I've come to see that you have an inflammation in your middle ear that is called otitis media. Are you familiar with this term?
No, doctor.
Well, basically, as I told you, it's an inflammation of your middle ear. There is, however, a small central perforation in your eardrum. That's how you felt the relief of pain this earlier this morning.
It's quite surprising for me, doctor. You're saying that there is a minor hole inside the eardrum.
Yes.
Isn't it a serious matter, doctor?
Well, I understand you're concerned about this issue, but I assure you it's not really serious. Usually it is common to see a hole in your eardrum accompanied with such kind of inflammation. But I assure you, with the best course of treatment, you would be regaining your physical texture of your eardrum and your hearing as well. Am I clear so far?
Yeah. So as you're saying that it's not that much serious matter, so I'd like to ask you, what do you think? What can be done for that?
Yeah, sure. For the time being, I'm going to prescribe you some broad spectrum antibiotic. Basically, it's antibacterial drugs that is causing your condition. But by the end of the course, we might see the perforation should be settled by then. And if you're having problems still continuing with hearing problem, we could always go for audiological testing if this continues. Is that understandable?
Okay. Yeah.
Okay, so do you have more questions or concerns?
No, I understand that you mentioned that I would be having some test related to my hearing after this time, after a week or so maybe.
Yes. Yes, after your course of
Yeah,
treatment is
and
done.
after that we will be able to know like what is the right condition of my eardrum, or this hole has been recovered or not, right?
Yeah, that's
Oh, that's great.
about
That
it.
sounds great.
Okay, well, there are some things that I would like to advise you against, in particular to your condition, if you're okay with that.
Yeah.
Well, I would advise against traveling using aircraft.
Oh, don't tell me,
As
doctor. I already have purchased a package for scuba diving, and me and my
see.
friends, they are going for scuba diving in coming days. So, is there anything that you can help me with that, like maybe maybe the earplugs that can help me?
Well, at first, that's quite a good sport that you're participating in. And I understand that you have booked and everything, but in the other hand, this is related basically to your health. So why not scuba diving, as the high up there the pressure is changed and this would aggravate your problem. So let's get that fixed first, and
Well,
we could
doctor,
always go for that.
it's a change of plan now. It's quite difficult for me to swallow this thing up, doctor. But I was thinking that if I can wear the earplugs and I can go there. So, but how much time, I have to wait?
You really don't have to wait long time. It's just a matter of, like, let's say a few days to a week.
Okay.
Just take your antibiotics and let's
Okay.
see how that will work.
Okay.
And then you can always reschedule your.
Okay, doctor.
Yeah. And I think that's all about it for now. Am I
Okay.
clear
Yeah,
so
doctor.
far? So, Michael, would you like me to go over?
Sure.
So basically, you came to me with a 3-day history of painful left ear, and this morning you have seen that there is some pus on your pillow, and suddenly the pain has was relieved. So after examination, I have come to see that you have an inflammation in your middle ear that is called otitis media. And why your pain has settled? Because there was a collection of pus inside your middle ear that led to a small hole formation in your eardrum. That pus came out, you saw it on your pillow, so therefore your pain settled.
Okay.
I reassured you that the hearing problems that you're facing right now is just only a matter of time, and this hole in your eardrum is not a serious thing. You will take your antibiotics, as I will prescribe you in a bit, for the whole course, and then we will review you after the course. And if your hearing problem continues, then we would go always for some tests to
Okay.
reassure you around that area.
Okay.
Finally, I have advised you against any activity that involve pressure changes. As
Okay.
you told me that you have booked your this sport with your friends, that's scuba diving.
Okay.
At first you were reluctant, but thankfully
Yeah.
we're now on the same
Yeah,
page.
you're right. Basically, I have to follow the advice
Yeah.
so that I can have a speedy recovery.
Yes.
Yeah.
So, Michael, do you have any other question that I
No,
can
it's clear
answer?
now.
Well, Michael, I really wish you a good recovery, and
Thank you.
hopefully we'll see you well soon.
Thank you very much.
Thank you.
Thank you. Okay, that was fine presentation. I really appreciate that. Let me give you the feedback on this
Yeah,
card
sure.
with reference to the marking criteria for the audience, so that they would have an idea about as well.
Right.
First and foremost thing is the personal relationship building skills and how to start the card.
Right.
So you have an appropriate start in regard to this scenario as the first encounter, and we can start the card the way you have started, with the normal greeting followed by the open-ended question. And however, this can also be started directly with the diagnosis. Well, after introducing yourself, like I'm Dr. Asma, I'm the doctor in suburban general practice. I've been through your file. I understand based on the presenting complaint, I believe that there's a condition. We are suspecting it to be blah blah, because the first point in your card was the diagnosis.
Diagnosis.
Yeah, so we can start in this way, that directly starting from the diagnosis, or before telling the patient that he was having those symptoms, and based on those symptoms we have that. However, the way you have started, it was also fine with the greeting followed by open-ended question. But you can see that the patient was talkative. He had given you all the information, like in one go. In this case, you have to recapitulate in your own language. So show the active listening skills. And followed by the next step that you had was the examination. And we can just use some statements. Do you mind if you can come to the couch? I'm going to see inside of your ear. I'll be using this device that we can say is otoscope. I will be gentle, okay? So if you feel any pain, just raise your hand. I'll stop there. So this kind of statement can also be used in the examination in this card. So second thing, that you have explored the patient idea, what the patient is expecting about the disease, right? That was also a positive point. And then you have explained the condition in a layman language. That is also quite appropriate way that you had. But we can use the graphical illustration for that. Let's say you can see that has been displayed on the screen. Now I am pointing the laser on the right side of the ear. Right now there is on the right side. This is your outer ear. Now moving toward the left side, you can see this is the interior ear, and now the laser is on the central part of the ear, that is called the eardrum. So or else you can see, let me draw this thing for you. You can see that ear have three parts like that. So it will be more better. At times students have a concern that won't be able to complete the card. Yes. Card completion is important, but it has to be the patient centered, because every point has their own marks. Right. So while explaining this condition in layman language, it's the patient centered approach that you're using the patient language, the layman language, and you're explaining in him quite simple language to explain the condition, okay? Right. And regarding the what we can say diagnosis, perforation, I guess it's a medical word.
Yes, it
is. So it should not be used as then we can say there is a minor opening. You have to explain the mechanism, where basically there was a pus that can be developed due to many reasons. So due to that pus, this was putting pressure on your eardrum and you were having severe pain, unbearable pain. But we can say it's a blessing in disguise that due to the pressure it has caused a minor opening. Rather than using the hole can be a negative word, you can say minor opening. Right. It's a kind of blessing in disguise. Now from that opening, now the infection is coming out. Yeah. It's a plus thing for us. So you can explain this thing in detail. Regarding the treatment, although you have explained it, but you can use the, like cohesive. First of all, what we can do. Secondly, and then we can ask, have I made myself clear? Do you have any reservation for the treatment? Okay, if you don't have any concern, let's move on to the prevention. It's a sign poster that you can use. And lastly, you have summarized as well. So it was wonderful presentation at your end. Your tone was quite appropriate. Regarding the linguistic part, you remain fluent in the card. And appropriate scenario, like in terms of appropriateness, we have the appropriate start, we have the appropriate tone. I would appreciate that. Regarding to formality, it was fine. Your stress management was also fine. I appreciate that. Linguistically, I believe it's fine. Yeah, I appreciate that. So wish you best of luck for your exam as well.
Thank you, Albert, on those areas.
Yeah, inshallah. So any question that you want to ask?
No, that's it, I guess.
Thank you very much for your time.
Thank you, sir.
Thank you.